case is the subtle miss, um, which again, I would love to get your opinion if what you think about it. So this is a patient had cirrhosis. This is an outside study. Comes with clearly, bunch of lesions. I think that there was only one phase. So again, this is not our case. So I don't take ownership of the quality, but you can see there's, clearly multiple lesions, and you can see that there is a pancreatic body mass, pretty clear. So and the CA99 was very high. So this was pretty much a pancreatic cancer slam dunk. You can see it here. As Artie says, the evil gray of tumor right here with pancreatic ductal dilatation. So they're associated IPMN. So not a like kind of subtle diagnosis here. So then the oncologist kind of says, well, the patient had a CT, MR about a year ago. Can you take a look? So this is our MR just about a year before. Oh, sorry. Okay, so this is the thing, right? So I'm looking, and I'll admit I read the case, and so it's hard for me to judge if it's if it's prospectively callable, because again, once you know it's there, so you can see that here's the pancreas, and admittedly the tail is a little less plump, right, than the
There
head
is
and
a
neck.
slight change in the caliber of the duct, maybe, as a
There is,
glue.
right?
Yeah.
Right. The indication, and of course, no mets. The indication here was Hep C, a lot of HCC, which we're transplant
Right.
center, we do a lot. So I read this as no HCC, and I read that multiple IPMNs, and that's it. So the kicker here is that they actually were concerned about pancreatic cancer. Patient had persistently elevated CA99, which was actually rising. So with that information, perhaps I would have picked this up,
Mm.
maybe,
Super soft.
right? Super soft, right? But like, had the question was evaluate the pancreas, maybe I would have said, something is there, and get an EUS. But um, so I don't know. Like, what do you guys think? Is this callable? I don't know. It's hard. Like once you know, and here's the post contrast.
Mm-hmm.
It's
That's
really
tough.
not very, very
Hard.
not impressive. And I'll show you the diffusion really. So you can see how you can kind of convince yourself that even if I picked it, even if I noticed it, I would have probably convinced myself that
What was the time interval between these two studies?
a year. And here's the diffusion. Really nothing on diffusion, which I rely very much on when I look for pancreatic stuff. There's just nothing there. The only thing, again, that could have clued me in, I think. Oh, and there was a PET scan, like right before, and PET scan was normal.
Wow.
Here, I'll show you. There was nothing. There was no. There was no. So I think that's also would probably convince me that there's nothing there.
I think it would be very
Nothing.
hard prospectively.
Nothing, right? But they turn out to be something, and I think, like when you go back, when I kept looking back, I think when you go back all the way back to maybe like 2016, you can see that the tail is not as atrophic, right?
Mm-hmm.
But then, like between 2016 and 2002 years, she has Hep C. We have a lot of patients substance abuse. I mean, could have been just, I don't know. Like, so it's hard for me to judge. Would I have come down? Would I've said something differently had they given me different indication? But these were all just cirrhotic nodules. And again, you can see here, like on delays, you can't see anything. So, but it was real. It was already there. So, an interesting case. But again, like, do you think this is callable? I don't know.
I think it's hard.
Very hard.
So these were all just cirrhotic nodules. Liver was full of them. So what do you guys think? Callable? Not callable?
I have a pretty low threshold for sending someone for EUS. If I see something funny, like it's impossible to say. If I would have said something about like the fact that there's something that looks like an IPMN there next to a duct that looks a little bit more dilated near one, and I might say, is it like a mixed type IPMN that's worth investigating? But I might not have called adenocarcinoma of the pancreas.
Right.